Good evening. Today we'll be discussing about empathy and how I use empathy with both my client and caregiver during my internship. What is empathy? Empathy is intellectual understanding to be able to understand what that individual is going through. So during my field placement, me and the field placement instructor, we discussed few points about empathy, how I can use empathy, and how I've been using empathy. One of the key points that I informed my field play instructor was having empathy with the clients, and we was discussing about that. So I gave her a few examples how there was a client, and usually I take him out because I perform direct therapy with that individual. So we've been taking him out in the community because he have taken out in the community to be able to socialize with his peers. So I begin to watch his breathing movement, his breathing. Every time he will go out, he would breathe a lot. So I brought that in to my field placement instructor to let her know that I've observed that his heavy breathing. So what I did was I contact his mother to let her know about his breathing. If he ever had asthma in the past. And the mother said to me, yes, he had asthma in the past for almost the last time that he used the pump at age 4. Right now he's 11 years old. So she said, do you think that he needs asthma? Do you think I need to order asthma pump? And one of the mistakes that I made was talking to my field placement instructor, and I was telling her about it. I said, I hope I didn't make a mistake. She said, you did good, but one of the things that you should do better next time, Joshua, always emphasize and tell the caregiver, whoever it is, even though you are showing empathy and you are showing compassion with that client, always let the caregiver go, whoever, that you are not a medical person and that they should seek medical purpose, because you cannot give medical advice. So that was one of the things we discussed, me and my field placement instructor, about never giving medical advice. Because when the mother asked me, she said, Joshua, do you think that I need to order a pump now? So from my perspective, I said, I believe so, you should, because he's constantly breathing. He always coughing, breathing. And she said the last time that he had his asthma, that he used the asthma pump, was age 4. Now he's 11 years old. So I said to her, just in the case of emergency, if anything happened, we are able to have that to be able to give it to him. So I was telling my field placement instructor, she said, Joshua, that's good. You are able to, you are showing empathy. You are letting the parents know what is going on. You are observing the parent, observing the clients of everything about that kid, because the mother may not pick that up, but you are with him and you are able to pick that up. So that was one of the things that we discussed about empathy. Then the other one that we discussed is showing empathy of being patient, right? Showing empathy of being patient, because I'm constantly patient with my clients, understanding to meet them where they are. So that's one of the things that I use, having patience, constant patience. I do not scream, I do not yell at the patient. I'm constantly having understanding, being patient, meeting them where they are, meeting them on the spectrum of their behavior, and meeting them on their expectation of what the behavior specialist activities and program that they have for them. So I'll try to meet them where they are, and understanding that the intellectual development and the age development is not correlating. So that's one of the things, being able to understand as a behavior therapist, you have to understand the behavior, understand their triggers, right? So those are some of the keys: having compassion, having empathy with both, with your clients and also with a caregiver. So that's one of the things that we discuss there in the field placement instructor, she also said to me, she said, yes, Joshua, you always do that, having patience for the clients and also having patience and understanding with what the caregiver, because I'm constantly, keeping updates and letting the parents know what is going on with their kids. So she said you was able to recognize and be patient, understanding with the parents and not being judgmental while you are telling them what is going on with their kids, because most behavior therapists will show judgmental, because as a social worker we are not so sure, we should be non-judgmental. I could have been like, it been almost 6 years and your kid does not have an asthma pump and his life could be in danger. So I did not behave in that way. I was able to understand her, because why? As a parent, we're dealing with kids that have disability. They go through so many struggles. They go through many things constantly on a daily basis, and understand her pain, understand her frustration as she go through. So we were discussing that with my field placement instructor. She said, yeah, Joshua, you was able to, she allowed me to see, she said, Joshua, you was able to see that, and being patient and being understanding and being able to give advice, even though you're not supposed to give medical advice, but showing your caring, showing empathy, understanding both the parents, understanding the client, that what is best in need for them. So that was some of the things we discussed as empathy, constantly showing patience, constantly showing understanding, and be able to recognize where both the parents at, how they are feeling, and where the clients are. So that's one of the key we spoke about during our 1 hour supervision, and just many other places, that because I always ask questions, that I did what was right according to principles, according to the NSFW Principal Code of Ethics. Is there anything I could have done better than that? So that was one of the keys that we discussed about empathy, the ability to be able to understand that individual, what they are going through, and how to have patience. So that was one of the key we spoke about, empathy.